Off a day and welcome everyone. The Committee on Health, Land, Justice and Culture is now called to order. Today is Tuesday, September 21, 2021. The time is 10:12 a.m. Notices for this virtual roundtable hearing were disseminated via email to all senators and all main media broadcasting outlets on Tuesday, September 14th and Friday, September 17, 2021. The notice was also published in the Guam Daily Post on Tuesday, September 14 and Saturday, September 18, 2021. All individuals will wait until called upon by the chair before testifying, and please state your name for record-keeping purposes as we go along. The roundtable proceeding will be transcribed and a committee report will be prepared as well. This is a virtual roundtable hearing to receive updates on Guam's public hospital from the Guam Memorial Hospital Authority. I'd like to acknowledge the presence of my colleagues, beginning with with the Legislative Secretary, Acting Vice Speaker Amanda Shelton, Senator Pito Terlaje, Senator Anthony Ada, Senator Joanne Brown, Senator Telotaitipui, Senator Christopher Duenas, Talina Nelson. I've got everyone, and thank you, senators, for being here today. I want to thank the Board of Trustees and their executive management team at GMH for reaching out to the Committee on Health to update the legislature on the hospital. We had a similar hearing on February 25th at the beginning of the term to receive updates on GMH's plans and priorities. And without further ado, I would like to recognize the chairperson of the chairperson is unable to attend this morning, but I'd like to recognize the board members who are here. And if the Vice Chair, Melissa Weibel, can introduce them, as well as the executive team. Lillian Perez-Posadas is the administrator and CEO, and she will introduce her team. And I've told them that they would have the floor. So without further ado, if I could recognize the Vice Chairman Weibel. Or Lillian Posadas, I don't see Lillian.
All right. Yeah, I guess maybe Trustee Weibel is probably having some difficulty connecting.
There you are. Okay, sorry, Lillian. It's hard to see you in the boardroom, but I see. So there's others with you in that one boardroom. If you could introduce them, thank you.
Yes, ma'am. Before I do that, I just want to again say on behalf of our governing body and on behalf of our employees and the patients we serve, and also the medical staff who are here to help us continue the operation here at the hospital. We just want to say thank you. Thank you so much for giving us the opportunity to, engage in a discussion, to update you all, and to also answer whatever questions that you have to help you have a better understanding of the services and the operations of the hospital and how that we continue to provide the services for the people of Guam. And so without further ado, I will then introduce the Board of Trustee members who are with us. I see Trustee Glynis Almonte. For now, I think Glynis is the...
Trustee Sarah.
Okay, Trustee Sarah. I apologize, Trustee Sarah. Trustee Sarah Netaduk is with us, has joined us. And in the boardroom, we do have our executive team. To my left, Mr. Kando, William Kando. He's our COO. To his left is Christine Takero, who is our nursing director. And then to her left is Lizelle Conception, deputy nursing director. And then across the table, we have Mr. Don Rabanal. He's our assistant administrator of administrative services. And then to his left is Yuka Conception, our CFO. Chenova. I'm sorry. I don't know. Conception just comes across. My apologies. All righty. And then we also have Justine Camacho, who is our driver with regards to our presentation here. We have Jeff Ventura. He's our chief hospital planner. And Belle Rada, assistant administrator of professional support services. She's our cardiac catheter nurse, so if you need her services, we can just call upon her. Dr. Jolene Ogden just left. She's back up at ICU doing her rounds. And also we have in Zoom, we have Dr. Annie Bordallo. She is our chief medical officer. Zaudi Tagadi, he's our FM manager. And we have Paula Menzon. She is our informatics supervisor. We also have May Habib. She is our PIO. Reina Cruz. She is in charge of the EHR. She's our EHR project. Anybody else? Vince Kijicho. Apologize to Vince. Vince is our IT MIS manager. Did I introduce everybody? All righty. Again, thank you so much, Madam Speaker and Senators, for giving us your time and attention to get you all updated and to allow you to ask us questions that we can then provide you the information. Before we begin with our agenda, I'd like to take you all on a virtual tour of the hospital. It's a very quick, very short virtual tour, just so you have a visual, I guess, understanding and how we've had to restructure the hospital since last year, and then we also had to stand up the areas for the COVID care with
Right.
our search. So,
Lillian, if you could give me 1 minute, I'd also like to recognize the presence of Senator Mary Torres and Senator Frank Blas, who have also joined us this morning. Thank you, colleagues. All right, please proceed.
okay, thank you. Let's go ahead and do the virtual tour. It will. Oh, we need the permission of the AV to share. Sorry, it's taking us a few minutes here to get the sharing.
I see Dr. Jolene has joined us again. Thank you,
Yes.
Dr. Jolene and Paula Manzon. Lillian, I'm not hearing any sound. Are we supposed to be?
Share sound.
There you go.
Okay.
Half a day. My name is Jeffrey Ventura, Hospital Chief Planner. Let me take you on a tour on how we accommodated COVID patients in GMH.
Can you hear?
This is our Care 1, which used to be, as you see, urgent care. We chose this location to hold our COVID patients. It's close to the ER, and it has negative pressure capabilities. The capacity here is 5. This is Care 2. This was the second care unit where we hold our COVID patients. Capacity here is 4. We chose this location as it's close to the ICU. Also doubles up as an ICU overflow. This is Care 3, which used to be pediatrics here. We moved our pediatrics down to Med-Surg 2 on the 3rd floor. We are on the 4th floor. The capacity here is 24. We are now at Care 4, which used to be telemetry. The capacity here is 24. But we chose this again because of its partial negative capabilities. With the help of the Army Corps of Engineers, we have increased our capacity and capability, adding more negative pressure and hemodialysis connections. As COVID started surging into our hospital, we had to create more care units. So this is Care 5, which is our ICU, intensive care unit. The capacity here is 14. This unit is capable of having negative pressure and hemodialysis within the room. Lastly, we have our Care 6, which is medical surgical ward, 3rd floor. Also, since we moved our pediatrics down to accommodate for Care 3, they're in this unit. The capacity here is 27. We are now in the ER. Behind me is the blue bed tent, which we needed to erect to accommodate and expand our capacity for ER holdings. Lastly, we have here behind me is the warrior tent that Guam Fire Department uses for their decontamination. Thank you for joining me on this tour. As you can see, we have expanded our capacity and capability, going above and beyond to accommodate our COVID patients.
Thank you, Justine, and thank you, Senator, for bearing with us on that quick tour. I know it's very quick, but just kind of give you a visual. Hopefully that helps you understand. But you're also welcome to come and do a tour. We'll just make sure we put you fit tested and make sure that you have all the PPEs to protect you. But you're welcome to come and tour the hospital physically if you'd like to. And so we'll go ahead and begin our presentation with the agenda that we've already introduced, our executive team and the board of trustees. You all, can we share the screen, Justine? We sent you a copy of our PowerPoint presentation in paper format, and so we can go through that, but we'll also share it on our screen so that you can follow along, and if there are questions, you can just stop us and ask the questions. But in terms of our agenda and what we would like to cover in this presentation and in this discussion, our strategic plan, our COVID-19 response update, also our financial posture and efforts towards achieving financial stability, and a little bit on the regulatory compliance with the accreditation with the goal to get accredited with the CIHQ organization, and where we stand with our CMS and our QAPI activities, and also the capital infrastructure update, particularly with what has been already reported with regards to the Army Corps assessment that was done in 2019 and the report came out in 2020. So we'll cover that part in terms of our CIP improvements and what plans we have to include the new hospital that we've been talking about to build for Guam. So I'll hand over the presentation now to Mr. William Kando, who will talk about the strategic plan, where we are with regards to the plan from 2018 to 2022.
Can you go to the next slide, please? Before we go there, we're also going to we're just putting this slide up here that shows you the our team, our board of trustees, as well as our executive management team. So we leave that with you, and you should certainly be able to refer to that when you as you have the hard copy. Next slide, please. As you know, our mission is to provide quality patient care in a safe environment. And our vision remains the same, is to achieve a culture and environment of safety and quality patient care, meeting national standards and addressing the needs of the community in a fiscally responsible, autonomous hospital. This may change in the near future. We are going to start our efforts, our assessment to start a new strategic planning cycle, because this plan goes through 2022. It has one more year. But now would be a good time to start planning for the development of a new strategic plan. Next slide. I'm not going to go through all of these. I'm just going to touch on some of them. The last time we presented to you in February, many of these are the same. Only you're going to see some of them. You're going to see completion dates. Number one is to achieve and sustain a successful GMHA COVID response and recovery throughout this calendar year through the end of December. Of course, if it goes beyond December and into the next calendar year, that objective will remain, and we will continue to meet that objective. We do that every day. Number four, full implementation and go live of the MedSphere CareView EHR project. I put on this one, the completion date is to be determined because it is being impacted by the COVID-19, our response and recovery. So some of the slides in this presentation, we're going to give you an update on the MedSphere, the go live for the EHR. Next slide.
Did you want to talk about the zeroing?
Later on. Number seven is the implement an enhanced and robust revenue cycle management program to maximize the capturing of incoming generating processes, services, and monitor and track cost saving opportunities dependent on the AG's review approval. This one was actually we've implemented this back in June. It was awarded, and so we've already commenced this. It's ongoing, and we'll be giving you an update later in the presentation regarding the revenue cycle management program. Number 12, continue collaborating with and engaging GIDA to complete the conceptual design plan for the new hospital facility. That started in March of earlier this year, and it's been monthly ongoing thereafter, and we'll give you an update on our efforts there. Next slide. Number 13, explore and begin the engagement of hospital accreditation by a nationally accepted recognized accreditation organization. Back in June, we settled on the accreditation organization CIHQ, and we'll give you a little update later on in the presentation regarding our accreditation efforts. Number 15, recruit and retain additional and critical human resources for the divisions of clinical, physical operations, and medical services, so as to reduce reliance on high-cost off-island travel nurse staffing agencies. So we've really been meeting this past year, and we've been meeting it every day and monthly. Thereafter, we'll give you an update on our human resource efforts later in the presentation. Next slide. Numbers 19 through 24 are updates on some of our capital improvement projects. These are recently completed projects, such as our communication center relocation and upgrade project completed back in March of this year. We completed the Care Unit 2 upgrade, electrical upgrade for enhanced COVID-19 response and recovery back in April of this year. The annual maintenance GMH main electrical distribution panel in collaboration with GPA. We've been doing that once a year, more as needed for the last 3 years, and it will continue for the next 5 to 7 years. We completed the repair to boiler number 2, replacement of boiler tubes. That was completed in April of 2020, and we're now working on boiler number 1, and we anticipate that upgrade being completed by the end of October of this year. We completed the following medical equipment purchases: OB ward beds, quantity 20, Innovator Health Telemedicine rounding system back in February of this year, medical surgical beds, quantity 40, that was back in February, ICU bariatric beds, quantity 2, that was back in March. The ready kits, the central monitoring system, 6 ready kits, a total of 120 monitors, because they come in 20 per set. That was completed this past year. Multi-purpose IR, cardio, C-arm, and renovation. That's ongoing as we speak, and it should be commissioned by the end of this month, as well as the multi-purpose OR, C-arm. They're being concurrently completed this month, and then we completed the install and commissioning of we're working on the second set of air handling units. So that's been awarded, and the next set after that is in the procurement process. So we're working on replacing our air handling units. Our milestones for this year and next year, into next year, it's going to bleed into next year. Number one, by the end of December, we're shooting for 97%. We're very confident that we'll meet 97% or exceed it. Of hospital staff will complete the COVID-19 vaccination series. We will achieve a reduction of the RN vacancy rate to 5%, thereby increasing our bed capacity throughout all the inpatient care units by December of this year. By the end of this year, we will achieve a cumulative collection rate of 60% from payers. And by the second quarter of next year, we will launch the new EHR. And because it has been delayed, it was supposed to be October of this year, but it is being delayed because our end users, our clinicians, had to be pulled back up to the floors to provide the ongoing response to COVID-19. So we'll give you more of an update on the EHR in the slides forthcoming.
For the next presentation and discussion, where we are in terms of our GMH COVID-19 update. Justine, did you want to speak on it? Or is it Don?
Good morning, Senators. This is Don Rabanal from JMH. So we'd like to give you a brief update of our COVID response. So as of today, the 21st of September, we have 39 COVID positive patients and 4 PUIs. As far as COVID ED discharges, we are more than 465 as of now. We were enjoying single-digit ED discharges from March until July. I apologize for the typo. The 60 total is for August, which started the surge, the third surge for GMH, and we're currently reconciling the numbers from March to September. As of yesterday, we're roughly about 200 ED discharges from COVID positive discharges from GMH. We roughly have 1,223 patients hospitalized. 113 of them passed, unfortunately, and 25 were DOA. Discharges is about 1145. And then COVID vaccine program, we have 92.7 fully vaccinated employees, and 107 patients of ours have completed their vaccination programs as well. As Jeff mentioned earlier within the video, we have several care units in the hospitals, care units 1 to 6. But aside from that, as we all know, we are also caring for the non-COVID patients, which are the PEDS, the surgical units, OB ward, and our SNF A and C wings. So if you notice, especially in surgical ward, we are actually exceeding our maximum staff capacity. It's the same thing with SNF, Care 2 and Care 3. We're actually flexing our staff. The nursing administrators are flexing their staff to actually cover the requirement of care for our patients as they come. Next slide, please. So the next slide shows the trend, the average patient census that we had for GMH since January of this year. Month-on-month averages are there. The purple line talks about the total average census of the hospital. The blue line are the non-COVID admitted patients, and the red bar are the average COVID admitted patients. So if you notice, the low points of COVID, as far as GMH is concerned, were really July in March, where we were averaging about 7 and 9 respectively. The non-COVID surge, as we called it, started really between May and June, where the non-COVID admissions average census grew from 125 to about 150. And unfortunately, the current COVID surge that we have now started in August. That grew from an average of 12 to about 41 daily. So if we just go back. So the maximum hospital beds that we have at the hospital is about 61 beds, so we're really surging beyond our current capacity now. Any questions?
Maybe
Right.
let's go ahead and finish and then they can.
Okay.
Yeah.
All right. And then I'd like to hand it over to Belle for the
Monoclonal.
monoclonal update.
Um, Good morning. My name is Belle Rada, and I'm here to talk about what we call MIB or monoclonal antibody infusion. This is used primarily to prevent COVID symptoms from getting worse and to prevent further hospitalization. I've given here a number from February to current to September, but as you see in the graph, our surge in August, we gave a total of 36. And then from September, if I can update that, it's we gave a total of 71. We have two kinds of monoclonal antibody. We have the Regenco, and the other one is a dual, which is the bamlanivimab and etesevimab. So we gave a total of 29 up to September, and in the Regenco, we gave a total of 71. Thank you.
And then now we'll have Yuka speak on our current financial posture.
Good morning. This is Yuka Hechanova. I'm the CFO at GMH, and I'll begin with a brief update on our August 31 financial position. Our net revenues are still a little below what we had from last year. However, we're in September, so we're getting ready to close the fiscal year, and we do make a lot of adjustments for September. Because our gross revenues are actually up, so we'll be making some adjustments. Our collections in August are a little bit lower than last year. However, because we have had the RCM consultants on board, we did see a 68% increase in our collections in August. So I'll talk a little bit more about that later. Our operating expenses increased from last year to about 25%. Fortunately, our federal grants also increased tremendously to cover those increases in expenses. Those increases in expenses are mostly for personnel. We've been paying, differential pay, the travel nurses, also some additional physicians that we've hired. We've also had to purchase a lot of medications and also PPEs as well. Our cash compared to 9/30 of 2020 is a lot lower, and that is because at 9/30 we had received a lot of the provider relief funds and other financial assistance for COVID, of which we had spent, of course. And our trade payables at August are 14.2, which is considerably higher. We have had some problems with cash, but as of today, it's down to 11.5. Because of the increase in the collections we had in August, we were able to make a lot of vendor payments to bring that down to 11, and we are working on that even till today. Next slide, please. The next slide, this is showing a summary of some of the financial assistance that we did receive specifically for COVID. We did receive 10.3 million from FEMA for travel nurses, and this was for last year. We are currently working with FEMA hand in hand to also apply for a new grant to pay for travel nurses that we really need right now. We also have other grants that we're working on with FEMA for overtime for the staff for the past year to respond to COVID, and also for the vaccination clinic that we held earlier this year. We received 9.7 million in provider relief funds from the Department of Health and Human Services. There appears to be another funding opportunity available at the end of the month that we will also apply for. We received 6.1 million in CARES money from the government of Guam for differential pay and physician pay. We also had 1.5 million from that same pot of money for our central monitoring equipment. And we also had 1.9 million in COVID TAP money that we used to pay for some of the travel nurses and also for physicians. Next slide, please. So in achieving financial stability, this is our goal, one of our goals in our strategic plan, especially for the fiscal department. We had been talking about this contract for the past couple of years, and I'm very happy to announce that we did sign a contract with MedHealth Solutions as our revenue cycle management consultants. They came on board the end of June 2021, and in July, they did several things. Overall, they did review all of the processes and all of the departments. So beginning with billing and the follow-up processes in detail, working side by side with our staff to really observe what they're doing. And their main thing really was just to identify where the roadblocks are to our efficient billing and collections. And so we've been looking more closely at Medicare and all of the roadblocks that we have at getting these billings through, looking at rejected claims. One of the biggest things we're doing right now is every day we're looking at an aging report and investigating why things are being held up and where the bills are in the process. So those bills are finally starting to move, and we did see in August a significant amount of collections because of this effort. We're also noticing in September our collections have also improved tremendously. We're also remapping some of our critical reports because we need better information to continue the monitoring. We've been working with our fees. We did hire somebody to take care of our fees and our charge master, and that is to prepare for submitting to the legislature by next June. So right now we're in the process of reviewing all the fees, what are fees that are being undercharged, what fees we need to implement. It is a massive project that's ongoing right now, but we do have a staff now solely dedicated to this project. We've also been meeting every day with the medical coders on what issues they have, and that's been very productive, so we can remove those roadblocks as well, and also with the registration staff on what issues they have with registering patients efficiently. So I do have the table here on the bottom of the slide actually showing that our collections in August was $12.1 million, which is $4.9 million over our average of 7.2. And like I mentioned, in September, we're also seeing some very positive improvements in our processes. So the ultimate goal of having the consulting team here is I've assigned a knowledgeable staff to be working with them, to coordinate, to shadow them. So all of this knowledge that's ongoing right now will be transferred to GMH so we can continue improving our billing and collections process. So the ultimate goal really is to develop a revenue cycle management director and staff to really be like the glue for all of these departments to work hand in hand to make sure that our revenue cycle is running smoothly.
This next slide, Madam Speaker and Senators, is just again to give you an overview picture of, in terms of our staffing, our FTEs, our full-time equivalent, and how many individuals, how many warm bodies fill those positions. Because we do have one FTE can have 3 staff nurses, part-time staff nurses. So, but the FTE in terms of what is filled as of August is 1,100.91 FTEs. Although we have more warm bodies, and that again, as I mentioned, is because some of these are part-time individuals filling 1 FTE. And on the right table there, you can see where the warm bodies are in terms of our staffing by the division. So, next slide, please. This next slide just again gives you an overview in terms of the regulatory organizations that we comply with, that we work with to keep us certified and in line with standards, particularly with the federal entity, which is the Centers for Medicare and Medicaid Services, which is CMS, and that we continue to maintain certification. They visited us. The surveyors were at our doorstep in May. And then they came again last week as we were surging with COVID. And so, but they came to revisit to then evaluate that if our plan of corrective actions, if we are following through. And so we haven't received yet the official notification, but at the exit conference, they seem to to validate compliance. So, and also the skilled nursing facility, the same. They revisited us in September, and we're still pending their final official report. In terms of the accrediting organization that our Board of Trustees decided to go with, that's the CIHQ, which is the Center for Improvement in Healthcare Quality. Our A team is working diligently, but we kind of had to put it on hold for a little bit because of this surge. But the first step is doing the self-assessment, and that's where all the department managers are going through the elements of performance and the standards to see if we are meeting compliance or not, and if we are not, what corrective actions do we need to put into effect to then meet compliance. Once we complete that self-assessment phase, we will then decide on conducting a mock survey. And so that's the next step after we complete the self-assessment, then a mock survey. We were kind of hoping to do it this year, but unfortunately, COVID kind of changed our plans. So, but we continue to work towards getting that self-assessment completed and getting the mock survey done. If not the end of this year, then definitely beginning of next year. Next slide, please. In terms of the electronic health record project, I'll let Don and Paula and Ray Cruz speak on it.
Dana?
Good afternoon, everyone. Can you hear me?
Yes, ma'am.
We can.
I apologize, my video is not working, but as of right now, our EHR project is at 72% complete. Since we last met, we have completed our EHR build team training. We've built our EHR system, and we have also performed an internal integrated testing to help prepare us for when the MedSphere team would join us and complete round 1 of our integrated testing. And for our wound care team, we went live with our NetHealth system. As of August 21st, we have placed the project on pause. And as Mr. Kando mentioned earlier, 95% of our team's resources have been pulled back to the floor, and that's to help address our surge of COVID and non-COVID patients. Once we resume, we will start working on our pending tasks, which are round 2 of integrated testing. And then we will start developing our training materials and execute super user and end user training. And those will help us to determine our actual go live date, which again is scheduled for sometime in Q2 of 2022. Thank you.
Thank you, Raina. Next slide.
Again, good morning, Madam Speaker, Senators, and everyone. Just a quick update on our capital infrastructure. Recently completed projects. We mentioned some of these already earlier in the presentation. We've got the Pyxis, really the Pyxis upgrade. This is where we dispense our pharmaceuticals. Is really at substantial completion. We're just adding maybe 1 or 2 more here and there, like in our OR. And so really, this one is really complete. The COVID care units 3 and 4 upgrades, electrical and mechanical for the COVID response was completed back in October of 2020. Comm Center was completed earlier this year. The Ready kits, all the central monitoring that we were able to procure from the CARES funds were completed in late 2020 and early 2021. We repaired boiler number 2 back in May of 2020, and we're going to be finishing the repair to boiler number 1 by the end of October. And then you can see all these various FF&E purchases that we've done throughout COVID: infusion pumps, BiPAPs, high flow nasal cannulas, uh, air purification systems, that's the BUE HEPA filtration systems, IT upgrades. Right now, we're installing and commissioning OR surgical lights. We've completed 1 out of 4, and then they just recently, the rest of them arrived on island, and we'll be finishing that this month and into October. Next slide. Additionally, we're going to talk about the telemedicine program that we've recently completed. I'm going to pass that on to Mr. Robinall to update us on this one.
Thank you, sir. We have the telemedicine and informatics supervisor with us as well, Ms. Paula Mandon. So, Paula, can you give an update, please?
Yes, so we started our telemedicine program in February 2021, and we are about 8 months into it, and we've since expanded to 7 telemed ICU intensivists who are rounding in the ICU. We have 12-hour shifts, days and nights and weekends. We have started a neonatology telemed physician to cover a neonatologist that has left the island. We also have started the hospitalist telemed program to help out the hospitalists that we have, the shortage that we have. We are looking forward to a rheumatologist service to start as well. And we also have 6 telemed technicians. These are pre-med students that we've trained to be with the telemed rounder. So you can see the start dates of the following services. Guam Memorial Hospital also has obtained the grant for FCC telemedicine at $722,000, and this should help out our program as well for telemedicine. We haven't officially gotten the funds yet, but we are awaiting that. So that's the update for telemedicine.
Next slide, please.
Thank you, Paul. Next slide.
Additional capital infrastructure updates, CIPs that are in progress or in the pipeline. As I mentioned earlier in the presentation, we continue to maintain the main electrical distribution panel and sub-panels at GMH. We have ongoing HVAC system upgrades. We've already replaced 2 out of 64 AHUs. We've awarded 7 more recently, and then we're procuring an additional 3rd set. We're doing this in a very phased manner because we cannot do this in a way that would disrupt our patient care during this COVID response. Many of these handling units that are being replaced are in patient care areas, so we're doing it very strategically and methodically. We've also completed the A&E design of the OR. This is for the HVAC upgrade of the OR, and we're now packaging construction, the construction phase IFB. We've completed the A&E design for ED and ICU HVAC upgrade, and we are proceeding now with efforts to then proceed with the construction phase. And then we are pending an A&E design proposal for the radiology department HVAC upgrade as well. We are assessing and maintaining 2 1.6 megawatt emergency generators and one 650 kW. We do this annually. We'll be doing this annually for the next 5 to 7 years. We're assessing. We did the assessment and repair of. We're repairing boiler number 1. As I mentioned, we've already repaired boiler number 2. Relative to the hospital roof and envelope upgrade, we did award the A&E design. The designer has already completed the assessment, and they're now packaging the first phase of the roof upgrade, which is focused on repairing the roof to the laboratory. And then concurrently, they're designing for the packages that will follow that as well. But first and foremost, we're going to repair the roof for the laboratory. We have the IR room and OR COM upgrades, installation and commissioning in progress. We'll finish that by the end of this month. We are packaging the angio suite. We're going to be working with the AG's office because this is a very large project. It's over $2 million. The Z-Wing abatement design, demo, and parking project. We've completed the abatement phase already. We are designing for the demolition. There's a small scope too that regarding the structural integrity for the small portion on the first floor that we're going to be salvaging that houses our active communication lines. We're going to be rolling that scope out very soon so we can procure that while the design for the demolition is completing. The design for the demolition will be completed within the month of October, and then we'll start procuring the demolition, the IFB for the demolition. The physician's parking canopy. This is a false ceiling within the doctor's parking as doctors and other staff enter the building. This ceiling poses a life safety hazard. It's coming down, and so we're going to be we're just kind of propping it up with shoring jacks, and so we have to fix this immediately. We have awarded this. This will be done by the end of October, and so we've cordoned off that area, and we're going to be rerouting egress and ingress into the hospital for the physicians so that they stay safe, and so we're fixing that as well. That was identified in the Army. All of these were identified in the Army Corps assessment. We are working with Island Equipment relative to a proposal to replace our liquid oxygen tanks, our large 1,500-gallon tanks. So we're working through that with Island Equipment, and we should be procuring that, awarding that very soon. We have the installation of new OR surgical lights in progress. We have ongoing information technology upgrades. Various medical equipment is being replaced, and we are also starting to replace our fleet of vehicles. We had a couple of vehicles that were donated by our Volunteers Association, and we're very thankful for that.
In terms of planning and development, before I discuss the Build a New Hospital facility project, I'll go first into the alternate care facility, which is our skilled nursing facility in Barracuda Heights. That's the designated alternate care, and we received approval from FEMA, the Public Assistance Project funding, to then prepare that facility as an alternate care facility site for possible, even for the current pandemic and future pandemic. And so we received the 15 million approval. Although we don't have the money, we had to pay up front for any expense. But there was a brief pause with that, but now we've been given the green light from FEMA to proceed. And so one of the first projects for that is to do the HVAC system, to separate the ventilation between the three wings so that we can then make sure we minimize the transmission of any airborne contagion. And so if we can proceed with that one, we've got the design and we're going to move forward with that. The other element to this project is the chiller. We've already requested, we've ordered for the replacement of that chiller, because right now the chiller went down last year. We replaced it temporarily. We have a temporary chiller that's right outside of the facility, but we want to make sure that we put in a permanent chiller, and so that's in the process. Moving forward now to building the new hospital. We've been meeting, as Mr. Kanda mentioned, the task force have been meeting since March. And go ahead to the next slide. So we formed our own internal task force here in the hospital to kind of craft and put the constructs of how we envision this new hospital to be. And so the components of it and the description is that we're looking at a 250 or 300 bed capacity. All will be single room. And we also wanted to have the centralized cardiac monitoring, which is a telemetry capability. And that way it's part of the standard vital sign checks for these patients when we have that telemetry capability in each room. We're looking at it being a 3-story high building because of the limitations in that area, and then 1 or 2-story underground to include employee parking, to include the communications command center, and some of the IT, MIS infrastructure, possibly having an auditorium and training rooms, materials management warehouse, and the facilities maintenance shops, and just space for environmental services. Of course, we want to make sure we have a chapel, a meditation prayer area. We want to include a long-term care acute facility. That's kind of separate from long-term care facilities such as skilled nursing. And why we're looking at that one, because again, with the COVID infections with the individuals, there's a long-term acute care need of these individuals with respiratory conditions. And so we want to make sure we include that into this plan. And then in a separate building right adjacent to the main hospital, we're looking at having an annex or a facility that will then house outpatient services. Outpatient clinics such as cardiology, intravenous infusion, oncology clinic, orthopedic, post-surgery, primary care, and even pulmonary care and rehab therapy. We factored in also into this facility veterans outpatient clinic because we were receiving information that of the 28,000 veteran population, the services that they're receiving right now is quite fragmented and they're not really meeting their needs. So that's why we want to put this in. At the same time, look for some funding to help us with this facility. And DISID is another client population that I think somehow they're kind of like left alone or orphaned. And so you want to include them in this campus or in this hospital to provide the services for these individuals. And of course, we're going to need to have a morgue and a CME morgue. The CME is not under our authorization or jurisdiction. It certainly is a separate agency, but because they occupy a certain section of our facility and we share some of the morgue space, we also want to make sure that they are included in this design. And viewing room, it's part of our tradition, part of our culture to make sure that we say our last goodbyes to our deceased loved ones. And we can never forget the volunteers. This volunteer association really they do a lot of support, a lot of fundraising activities to support the hospital. So we want to make sure we include them into this facility, this new hospital. Next slide. Again, just a picture of how we envision the inpatient clinical services and medical services in this new hospital. These are the traditional medical services, but I want to emphasize that in the ICU, progressive care unit, right now, what we have are really nice rooms. They're enhanced, they're spacious, but they don't have bathrooms. So we want to make sure we factor that need in our ICU. Also, in terms of the pharmacy services, we want to include an outpatient portion there, an outpatient component, and possibly even share that service with public health or even behavioral health at that campus. Operating room, right now we only have 4 OR suites. Into this new hospital, we want to have 6 OR suites for general surgery and for orthopedics and possibly robotic surgery, looking into the future, and a procedure room, and a cardiac cath room, and an interventional radiology room. So in this structure also, we want to make sure we have a pneumatics chute system. This is a system that you can send document or something throughout the hospital without having to walk to that area. So that's what that pneumatics chute system is. Additionally, at the very bottom of it, there's that 4-bed inpatient secure care unit. We factor that in just in case, like we have patients from DOC who needs a security guard, or even possibly making that a section for veterans who need acute admission. So that's part of the facility structure that we envision in this new hospital. Next slide. And again, the administration and operations and non-clinical services, pretty much the traditional non-clinical services that we currently have. And that's how we envision it at this new hospital. So in a nutshell, Madam Speaker and Senators and guests, this is our presentation This concludes our presentation, and we're opening up now for questions, and if we can answer them, certainly I'll give you the information. Thank you.
Thank you very much, Administrator Posadas, and to all your team and to the medical staff and nursing staff that have been involved, and to all of you. It's an excellent presentation, very thorough. A lot of the information that we have asked throughout the years updated all at one shot. I really appreciate that, and I appreciate all the work that is very obvious that you have done, not just in COVID response, but in all the other areas that have been long-standing issues. And I just have one question that I've been wanting to ask, and that is regards to the Regeneron policy. I wanted to know what is the policy as to who will be treated with these treatments, or with the Regeneron or the other types of monoclonal antibody treatments? I've heard several instances of people who've been turned away at GMH, even though they were referred by doctors to receive treatment, or they come in on their own. And so I just want to know, how are the decisions being made on that, and how can we ensure fairness and equity? I guess now that you have received your full supply, this question is less, maybe not as stressful as before when we were just looking at a few of the doses. But maybe if you could just talk a little bit on that, and then I'm going to open it up to my colleagues.
Okay, thank you for that question. I'm going to yield that to our COVID guru, Dr. Jolene Ogden.
Half a day, speaker.
Half a day, Dr. Ogden.
So we don't turn anybody away that is seen in our ER who actually qualify. We have had a time where we actually didn't have any, and if our ER is full and we don't have staff to give transfusions, then they won't be given transfusions. And so what we've been doing is giving our supply, majority of our supply goes to the GRMC transfusion clinic. We tried really to do at least 8 a day, but it was backing up the emergency department. And I need to make this very clear. The ER cannot have hallway beds. We cannot be backed up for a transfusion. We have to always have a bed available for a patient that really needs to be seen and admitted to the hospital. So if a patient comes and is discharged and we do not actually have staff to do the transfusion, they are usually referred to the transfusion clinic at GRMC. We have a very small clinic, and it's timed, very short hours for our ER, so that they can discharge the patients and refer them to the clinic during these specific times. It is for our pregnant patients. It is for our staff and our staff family. It's a very small scale compared to GRMC's transfusion clinic. We are not saying everybody come to GMH, because our ER cannot handle that. By no means can we handle that. We have been consistently on diversion, and we are overstretched.
All right, I appreciate that. I'm glad you clarified that. Does the amount of doses, I guess, that you are getting at GMH, is that the amount for Guam, and then you dispense it to GRMC or to public health, or is it the reverse?
So all agencies have actually requested for their monoclonal antibodies. However, GMH has been the only one who's been receiving both monoclonal antibodies. And we did just receive the 300 vials from Palau over the weekend. So that was 250 of those vials of the 300 were sent over to the GRMC transfusion clinic. As far as our Lilly, we had 138 vials and have sent over, I believe, about 60 to 70% of it over to the GRMC transfusion clinic. So because they weren't open on Saturdays and Sundays, we tried to help the patients that are presenting to TGen that the physicians are referring to see if we can fit them into our transfusion clinic.
All right, great. Thank you very much. And appreciate your efforts, Dr. Ogden, and through all of this. And I really appreciated that in the last press conference when you gave that very practical advice. I think that was very effective, and I hope that you continue to do that. That very practical advice as to symptoms, as to what to do when, I think is very important. So thank you.
Thank you.
I know there's a long list of senators. I'm going to begin with Senator Pito Terlaje. You are there. If not, then Senator Anthony Ada.
Thank you, Madam Chair, Madam Speaker. I just wanted to, thank the hospital administration and those at GMH for all their hard work during these 18 months. I know it's been really taxing on not just the facilities, but also the staff. And please convey to your, to everyone there at GMH, our heartfelt appreciation for all the work that you guys have done and continue to do for our island and most especially our people. The only questions perhaps that I would have is, I've listened all to the different upgrades in the air handling units and the different pods that are being set up as well. The question I have is, the electrical panel that was a main concern a couple of years ago, and I heard that it was, there's maintenance going on with it. Can it handle the capacity of the additional plugins for air conditioning for the blue tents, the different blue tents that are set up? And I understand there's a portable morgue that's going to be acquired, or I believe there was one there as well. With all these electrical inputs being placed onto that panel, is it going to be able to handle that capacity?
Yes, thank you for that question, Senator. This is William Cando. Yes, so before we installed and then now installing any of those, they're assessed electrically by our both internal and external partners. We haven't added any major load. Even when we did the upgrades to care units 3 and 4 by the Army Corps of Engineers, the contractors assessed the load and did the electrical assessment prior to and looked at the design. It was incorporated in the design, and they before proceeding with any construction confirmed that it's not going to. It is a load that can be carried by our system, and so that's we just cannot go forward and do any further major expansion to GMH. That would really tax the system, and we certainly don't want to take that risk.
I see. Okay, thank you. And then, in the news media, it was said that a portable morgue is coming in. What happened to the one that was there right outside the medical examiner's office? Is that still operational?
That went down. Mr. Jeff Ventura.
Hello, Senator Papadakis. This is Jeff Ventura. That was removed early May, because it needed to be replaced due to it being inoperable.
Did we purchase that, or was that loaned to the hospital?
It was a donation to the government of Guam.
Okay, that's great. That's good to know. So you guys have one that will be coming in, I believe, that is by the National Guard that will be providing that.
It's a loan.
I believe, Senator, it's also a loan one, a donation.
Yes.
With the condition that it's not to be owned by the government, but just used by the government.
Right.
Okay. And what's that capacity going to be able to hold?
I believe 23.
23?
23 human remains, adult human remains.
So are we currently in both the CME side and the hospital side? Are we over capacity at this point in time, or are we okay at this time?
We have some vacancies, but there are times when it is full, and part of it is that when the deceased individual, the family is not able to arrange with the funeral homes to pick up the body. One of the reasons is that the family are in quarantine, so they're not able to make the arrangements or whatever it is with the funeral home, so that delays it. But right now we have some vacancy.
Yes, we did.
I see, thank you. And then also, the other question I had, and this was very alarming, was the 25 patients, I believe that you guys were said DOA.
Right.
And I know they come in, if they're DOA, they still go in through the hospital side. Who determines the cause of death, being that we don't have a current medical examiner on staff?
I guess I'll take that question. Thank you for that question, Senator. Right now, the Attorney General has a contract with the pathologist in Saipan, Dr. Dodderman, and he comes every 2 weeks, and he does some kind of a look and see examination, and he's the one who makes that determination. If it's a COVID patient, they don't do autopsy, they do a look and see physical examination to see if there's any kind of a questionable event that may have caused or contributed to that individual's demise. And so it is a contract that the AG has with the pathologist in Saipan. We also have our pathologist, Dr. Aburizik, who on occasion he gets called in to do a look and see exam also, because they're not forensic pathologists, and so they do some kind of an examination that they can make a determination whether or not there's anything suspicious or that it is an actual cause of death.
Yeah, and I think that's a concern, right? Is that, being current Guam law requires that anyone that expires outside of the hospital be examined by a medical examiner, and us not having a medical examiner here, I mean, we can all say that yes, they had COVID, and yes, they passed away on the way in, but the actual determination, I think, is very critical to that, because I mean, when you look at what the media have reported, that a couple of patients who passed away last year now were deemed COVID patients, and I think that's alarming as well, because if they weren't COVID status then, what difference did it make looking over the records? Like you said, they do a view and research, and so what was different today that what they didn't see in December? And I think that's what's very alarming and concerning, that we need to ensure that, when we report these things out to the media, that we're as accurate as possible. And again, I'm just gonna, voice my concern of a medical examiner being on staff. And I think that, it doesn't fall under the purview of the hospital, but I think the hospital too should be concerned that, if we can't determine what's the cause of death because we don't have a medical examiner, are the staff and patients at the hospital susceptible to any other, bacteria or whatever it may be that could result of an individual's demise. But that's the only questions I perhaps two other questions. I'm sorry, Madam Speaker.
If I may also just add a little bit to that concern that you have with regards to individuals coming in as DOAs, they get swabbed. And so, the test comes out whether it's positive COVID. So that's one area of determining that there is that, COVID, I guess, diagnosis on the DOA. But just one more thing on the CME, there is a contract that the Attorney General has with the Honolulu forensic pathology. And so they can call on them to come to Guam if there really is a need to do a forensic autopsy. So they have that option, but it's on them whether or not to make the decision to bring in that forensic pathologist.
Yeah, and that's my concern as well, is that, our law here calls for a forensic pathologist, and we should have one, all the time, and not just call when, we deem that, okay, I think we should have one, call them in. That's the whole different context.
I believe that the board is having a meeting today, the board that oversees the CME is
The
having a
postmortem.
meeting today, and I think that they have good news. I mean, that they have some interest in the position. So hopefully we'll be hearing some
Right.
progress in that regard.
Thank you, Madam Speaker.
That's the
The only
postmortem.
other question I had is, you spoke about the new facility. Have you guys determined a location for that new facility?
The desired and the location that we are going forward is the Manila Eagles Field band, and that we know it's right now in the hands of the military, but there is a process that is ongoing right now with the governor and the military authorities that land will be handed over to the government with a license to then lease it for the specific purpose of a hospital medical facility. So yes, that is the location that we are going towards to build this hospital and this new campus.
Okay, thank you.
You're welcome.
Thank you, Madam Speaker. That's the only questions I have.
Thank you very much, Senator Ada. Legislative Secretary Shelton, you're recognized.
Day. Good morning. Thank you very much, Speaker. And thank you to the whole GMH team for that presentation. That was extremely thorough. So many of my questions were already answered, so I really appreciate it. I think I just have one follow-up to the information given on collections. I know that now you have the RCM consultants assisting with the collections efforts, and I'm glad to see that it's really helping. Do we still have the Attorney General assisting as well?
Collection.
Yes, yes, Senator, we do. We still work with them on the patient accounts that will move to small claims court, and also for calling some of the problematic accounts also to encourage the patients to come in. We also have our collection staff calling these patients as well. But yes, the collaboration is still ongoing.
Okay, thank you very much. I'm glad to see there's still progress there. I know that there are other much bigger priorities in the hospital right now, especially dealing with the pandemic and the surge at this moment. And I'm happy with all the clarification you gave about the antibody treatments. I know I also had several calls to this office asking what they should do if they were to be turned away from GMH. But my understanding was it wasn't that they were necessarily turned away, but referred further to GRMC for the treatment, so they wouldn't have to wait so long. So I do appreciate all of the efforts that you're doing and being able to adapt during this time to continue serving everyone. Thank you very much, and please be safe. And we are continuing to pray for all of you, and so grateful for the work that you're doing. Sitios Masi.
Thank you.
Sitios Masi, Senator Brown, you are recognized.
Thank you very much, Madam Speaker. I certainly appreciate the update that's been provided by GMH, but I did want to ask Mr. Kando with regards to the upgrades to the existing facility. Have we ever addressed, I understand you did give the update with regards to the generators there at the old hospital, but do we still have the issue of the water tank located within proximity of that in your facility? Has that been addressed, or is it still in the same area?
Thank you, Senator, for that question. Yes, that holding tank is still sitting in the same area. It still poses a risk because of its close proximity to the main panel. We do monitor it, and as far as its integrity, because we are planning for a new hospital, we're right now we've been just currently maintaining that tank.
Okay, well, hopefully it doesn't spring a leak, because it's going to cause, as we've discussed in the past, certainly a major problem being so closely adjacent to a lot of your electrical operations there. With regards to Z-Wing, what is the ultimate decision been made with regards to that facility? Are you going to have it demolished? Is there portions of it that can be renovated for use from the current hospital, or what is the status? I didn't quite get that clearly spelled out during the presentation, so I just wanted to ask for clarification.
Yes, Senator. So the decision was made because the A&E designer informed us that if they retrofitted the building, they could not guarantee the structural integrity of the building and its occupants. So So the decision was made to demolish all of it with the exception of an area on the first floor closest to the main lobby that houses the active communication lines and also housed a portion of what used to be the former business office, the front portion of the business office, and where the cashier windows used to be. And so it's about 2,000 square feet thereabouts that we're salvaging. The rest of it, and then before we proceed with the demolition, we need to add to the structural integrity of that area before we proceed with the demolition, just to make sure that we don't compromise that area on the first floor and those active communication lines. Once we finish the demolition, we will be expanding our parking. So there will be a phase where we're able to expand some of our parking.
Okay. No, I appreciate the information on the square footage, but at least on the second floor, that portion of the building where you're saving on the first floor, and I am familiar, you're talking about right when you walk in, it was to your immediate right where the window cashier office used to be. So the second floor of that area, that will be demolished?
Yes, ma'am. Everything on the second floor will be demolished, and then the majority, I would say about maybe about 60 to 70% of the first floor will be demolished as well.
Okay, with regards to equipment, we were given updates certainly on the work, and I think we all appreciate the additional maintenance and upgrade that's being done to the current hospital. But just with regards to some of your medical equipment there, because I do recall, and granted it's been a couple of years, but you had some very aged equipment that was still in operation. What is the inventory with regards to that to make sure that, you know, the medical equipment that's needed in operations and other, you know, support services for your patients there? What are we doing with regards to that age inventory? Has that been phased out? Are we able to acquire new medical equipment to provide for the, you know, the needed services that you provide at the hospital?
Thank you, Senator, for that question. This is the silver lining of COVID-19, where we were able to procure during this response quite a bit of medical equipment, thanks to the federal funding that we received. So we've been going through this process for a year and a half, almost 2 years now, where we were able to procure central monitoring systems, beds. Now we're installing and commissioning surgical lights, C-arms for the radiology department, X-rays, hemodialysis. We're in the process of getting hemodialysis machines. So we're certainly we're keeping very close track of the inventory list of both our critical and non-critical equipment, and we are replacing those now as soon as possible, because, you know, if we're going to be here for the next 5 to 7 years, and most equipment has a useful life of about 5 to 10 years. We need to take advantage of it now, and so the good news is we've been procuring quite a bit of medical equipment, and we will continue to do so into the next year as well. And as useful, we have our listing as useful life is exceeded, and we're also monitoring. We're doing PMs on this equipment, so we know if we're starting to have problems with the equipment. We're not waiting. We're replacing those equipment.
Well, I'm sure that must be a godsend, certainly, Mr. Kando, for all the years you and other staff have worked there in needing this equipment. So that's also good news. One of the things I hope you collectively are looking at is, as you look at transitioning, while it is a few years away, to a new facility, that you're also planning the exit plan for the existing facility, because that did not happen. Well, it's been a number of years. Certainly, I don't know if anyone at the table was around at the time. Certainly, I was not in a government capacity when the transition happened from the original OGMH at Oka Point to your existing facility. A lot of the equipment, documents, human remains that were left in formaldehyde in the basement were left at the old facility without any consideration to properly sanitize and remove, survey out, whatever the case may be, hospital beds. I mean, the list goes on of what was literally abandoned at the old facility that ended up becoming a major structural and environmental hazard. So certainly I hope that as we're looking towards a new facility, we're properly addressing the exit plan, and then also what is reusable. I mean, we're of the, the idea if we're going to build a new facility, everything should be brand new, but I think we also need to look if there are usable equipment or resources in the existing hospital that can also be transferred, that has a lifespan. I just want to be cost effective because, as the presentation was being made, and I'm sure things will be, refined further as we move along in this process. But adding on additional operations, while DISIT also, I don't disagree, is an important operation in our government, one that certainly needs more support. I'd be a little cautious about continuing to add things onto an existing facility that we have yet to find a defined cost. Because if we're looking at financing, or maybe if we're fortunate and the federal government's going to pay for the bulk of this, and this is not something we're going to borrow a substantial amount of money for, then that's a tremendous plus. Certainly, I think we can all agree that's going to be a very good thing for our community. But if we're looking at doing long-term financing, and I've heard up to 40 years has been discussed when Gita came to do a presentation to us at the legislature. I mean, if we're going to use that as the basis, and by the time that new facility is paid off, if we don't maintain it, we're going to be in the exact same situation we are now, where we're going to end up with a facility that's aged, and then the expectation that we're going to build every 40 to 50 years a brand new facility. And I just don't know if that's desirable or feasible financially, when there are many other operations in this government that including in many of our schools, that are far older than our existing healthcare facility that we are in right now. So I just want to caution that. And then also for the Veterans Affairs, I mean, I appreciate wanting to support the veterans. I'm the daughter of a combat veteran, so I can appreciate that. But again, I also want to know, as was mentioned, who is going to finance that portion of the operations, which currently is being addressed by the federal government. I don't want to add additional cost into a new facility, which I think is going to be quite substantial, and recognizing, a lot of effort is put into the physical construction, the type and design of the facility, how it's going to look, what we're going to put in it. But I also want to make sure that we don't fall short as we are now and as we have historically with our current hospital, not ensuring that we have the staffing capacity needed, the expertise in certain critical areas that we need to provide those type of services. Making sure we have the resources to ensure we have the medicines and other things that we need, which, have always been an issue. I'd like to think money's going to keep falling from the sky in the federal government, and Uncle Sam's going to keep writing checks to us, but I think that's not the real world, and that's not going to continue. I fear if this COVID continues another year or two, where are we going to be? And I think we need to be a little cautious moving forward. So while I would love all, the fancy wheels and everything that turns that goes with it, I think we just need to be mindful of what exactly are we adding on. I want to see the core needs of a hospital and not adding on more, because I don't know if we can afford, or our people can afford, all the things we want to add on. I did want to ask with regards to how you're going about the design. I mean, I know we're not at the physical drawing of a hospital, but how do you plan, or what's your proposal so far, if I can ask our hospital administrator? How are you looking at moving forward and partnering on getting the proper right sizing? You did mention the number of hospital beds and, general, the overall scope of what you're looking at for the need for the new hospital, but what official expertise that has expertise in hospital design are you going to work with Army Corps, or what proposal are you looking at to make sure we have that type of expertise at the table and in actually designing and making sure you have a functional hospital that's going to meet the needs of our people moving forward?
Thank you for that question, Senator. And you're absolutely right. I don't portray myself either to be an expert. I'm not an engineer. So yes, we are looking to the expertise, and we are in communication with the Army Corps. When they were here, Colonel Eric Marshall, when he was here in August, we met with him and his team. And so we submitted a letter to the governor's office for her signature to request for the assistance of the Army Corps of Engineers and their expertise through the DOI. And so therefore, the planning charrette is what they're calling it. And so from there, they will then use their vehicles, their tools to acquire the expertise of designing the hospital and getting even a contractor to build the hospital. But we're not there yet, but the communication and the discussion, the dialogue is there. And the Army Corps of Engineers have been very receptive, and they really want to help us with building this hospital for Guam.
Well, I appreciate your input with that. Certainly, Ms. Posadas, and all the work that you're doing. I know you guys have a lot on your shoulders, especially dealing. I mean, in normal days, you still have a lot on your shoulders, but
Yes.
certainly on top of this challenge with COVID and trying to address this second larger surge and what our people are being affected, we recognize the work that you're doing. I know there are all these other details and challenges, but certainly, you know, I appreciate, and I'm sure our community appreciates all the work and dedication that all of you are putting into this process today, and certainly as we're planning for the future. I'm sure there'll be other forums for us to further discuss this, but thank you for the presentation, and certainly, Madam Speaker, thank you for the opportunity to comment and ask questions on this issue.
Thank you, Senator Brown. Senator Teichgui, you're recognized.
Thank you, Madam Speaker, and thank you for having this public hearing, this oversight on GMH. It's very helpful for the public, not only for the senators, but for the public to see where GMH is standing right now and what are their needs and what especially what they've accomplished. So I greatly appreciate the presentation that was brought before us. And I thank everyone that's here today, even though you're not speaking. I appreciate you being here and listening to what we have to ask or our questions. There was a couple I have with regards to I believe it's on page, might be very simple. I don't see the page, but current financial posture, it might be go to Ms. Pachanova. When you explained the current financial posture with regards to trade payables, what exactly, is that just a fancy word for, you know, what's owed to the government in Guam, or can you kind of explain that?
Yeah, absolutely. Trade payables is what we owe to vendors.
I see. Okay, that's what it means. Vendors. Okay, thank you. Also, Lillian, who updates your website? It was mentioned earlier. The reason why I'm asking was mentioned earlier by the speaker, you know, giving kudos to Dr. Uggen with regards to the information provided to the public on, you know, symptoms, etc. You know, all these things that and visiting your website at GMH, it doesn't really have a whole lot of that information there. Some of it is outdated, and was wondering, do you update your website daily for the public to review?
Yeah, great. Thank you for that question. Vince is our MIS IT, either Vince or Don, but yeah, that is something that we want to make sure we update.
Yes, ma'am. Yeah, so we have a few articles that we have within the website. We do several updates together with our PIO and our hospital IT administrator, and we will update our content, ma'am. Thank you for the feedback.
Yeah, I appreciate it, because even if you go to the COVID Care Hub, you know, it doesn't really give a whole lot. And the information that was provided by GMH with regards to symptoms, like I mentioned earlier about Dr. Uggen's comments, and even, you know, and malfunction when you're going, I'm sorry, not malfunction, when you're going on KUAM and explaining certain things, a lot of that should be put into the website. People go there now when they want information. I see you have your visiting rules and regs during COVID. And so I think it really needs to be updated. With regard to the contract with MedHealth Solutions, can you tell me how long that contract was signed for?
It is a 1-year contract term with options to renew for another 2 years.
So 1 year and then an option for a 2-year. And what is the cost of that contract?
We are paying them 12% of collections above 7.2 million. So it's dependent on how much they help us collect.
Okay, so 12% up to 7.2 million of what's collected, right?
Above 7.2, yes.
Above 7.2, or like
above.
Anything
Okay.
anything over 7.2.
Over. Okay, thank you. Okay. Senator, yeah, my concern about the morgue and the facility. Senator Nader brought that up. Thank you for that information. It's good to know. I know it was in the paper recently. To the skilled nursing facility on page 17, it talked about a report that's supposed to be coming shortly. Do you have a date on that? This is regarding let me pull it up.
CMS survey?
Yeah.
Hi, this is Danielle Manglonian. This is in relation to the report from the Centers for Medicare and Medicaid Services.
Yes.
We were always told that we would be getting that report within 10 business days. However, track history wise, we always receive it later than that.
Okay, well, within 10 business days, what day is that?
Let me calculate that real quick.
Yeah, they were here.
Thank you, appreciate it. That information is going to be very important.
Let's see. That would be around this coming Friday or next week, Monday.
Okay. Is that information provided to the speaker? Is that a requirement from GMH to provide that report to the legislature once received?
Is it required for us to provide a copy?
Yeah.
It's not a requirement. Again, we wait for the official notification from CMS.
Okay, it'd be good information to have. If we can, Lillian, the oversight chair, if you do have that report, to provide it to her so that we can review it with the other colleagues. Appreciate. Now, the last question I have is under, I believe it's page 13. When you talked about current financial posture and all the CARES funds and COVID grants that you've received, these are fundings that, if I'm not mistaken, that you have received currently. Do you have a list of potential or anticipated funding being received to Guam Memorial, to the hospital, in the lines of, ARP funding or any other grants that are potential? Do you have a list of that?
Well, a list, not exactly, but for example, I keep track of everything that comes out from email releases and whatnot about potential grant opportunities for COVID. So for example, I mentioned that from HS, the Provider Relief Fund is having another offering. They said they're going to open the portal towards the end of the September. So I'm going to log in September and apply for another grant. I don't know how much we're going to get. We're also applying for we're really working very closely with FEMA and asking them to help us fund the travel nurses, some equipment, PPEs, those things. So we do work hand in hand with FEMA. So those are the two grants off the top of my head that I know that are potential, that are coming down the pipe.
And these are not part of the current financial posture area, because you already have the 10.3 from FEMA, 9.7. These are fundings that already have been given to.
Yes, yes. That's actual cash that we already received. The ones I mentioned earlier are the potential ones that we haven't received anything yet.
Yeah, and that's very important to know how much money you plan are coming your way. How about, Lillian, any promises by the governor given to you with regards to using ARP funding?
Absolutely. We were in a meeting yesterday, and we have had also communication from Mr. Ed Byrne, DOA. $7.27 million already is allocated into a GMH account. And so we've already signed the documents. UCA will be drawing down from that account of 7.27 million to help cover pay the 90-day bucket of payables that we owe vendors.
Oh, that's good news. It's awfully small amount. Do you anticipate additional knocking on the door again? The
Well,
governor.
sure. I mean, the governor is committed to help the agencies and to help us here at the hospital. And so we will, don't worry, we will ask.
Okay.
We'll ask for more funding.
And with the budget bill that was just recently passed, Lillian, do you see any issues with not being able to cover what you currently have, that's currently in the budget bill for FY 2022?
We're a little disappointed that, it was cut by $10 million. We were also given the assurance that the $5 million that DOC, owes GMH, that did not get factored into the budget. And so we're disappointed. But, that doesn't mean we stop operations. We have to continue the services and the operations. And that's why we have this RCM group help us with our processes to then, capture the services that we provide. We're finding out that there has been some services that we're not capturing, so now we're seeing it, and so we're making sure we're capturing those services that we provide.
Well, I think knocking on the governor's door right now to cover any shortfall. I mean, she mentioned that publicly that she'd be standing by using our funding to cover any shortfalls. And right now, it sounds to me like the 7.2 is going to cover some of that shortfall.
Yes.
So hopefully you can gain the excuse me. Hopefully you can gain the remaining 7 more million or 6 more million to cover the remaining amount. But my math is off on that one, but it's probably a little bit more than that. So I appreciate excuse me. I appreciate all the work that you're doing at Guam Memorial Hospital, and to the staff and supporting staff, all those employed at GMH and the skilled nursing unit. I greatly appreciate the hard work that you're doing, considering this pandemic that we're in, going beyond your normal duties. You're greatly appreciated, very much so. And thank you to the trustees for keeping a vigilant eye on the working of the hospital. So greatly appreciate it. Thank you, Madam Speaker, for the opportunity. I wish everyone the very best. Thank you.
Thank you.
Thank you, Senator Taitakui. Minority Leader, Senator Dueñas, you're recognized.
Tidus Masi, Madam Speaker, and to Team GMH, Ndankuna Tidus Masi, to all of you as well for all that you're doing. I join my colleagues in appreciating the update, very thorough and very nice work and very informative. Many questions have been asked. I just have 3 that are, I think, relatively short. First of all, on the CIPs along the line of the funding, are all the CIPs that were identified that have been kind of long-standing and are current carryovers, are those funded?
Yeah, thank you, Senator, for that question. So the Army Corps assessment, they estimated a need to sustain GMH for the next 5 to 7 years of about 21 million. And we think it may be a little more than that, but all of that is not currently funded, and but we're strategically hitting the needs, sets of CIPs at a time. It's not like we could do $21 million worth of CIPs in 1 year, and the assessment, a lot of the assessment is really a long-term improvement. A lot of it is maintenance that would be done over the next 5 to 7 years. So that's why we're doing it very strategically, and it's long. So a lot of these projects are long-term projects, long-term planning, and so that's why we're working very closely with the governor's office to hit our greatest priorities, and then we'll move on to the next set of CIPs as soon as we can, so that we do it in a way that doesn't disrupt operations.
Thank you, and we just want to maintain those communications from the legislature's perspective, whether or not that will require appropriations or that will be done within your budget. So I'm sure you'll continue to update us. Lillian, I've been getting some questions in my office that you've made the announcement now that there's been a suspension of elective surgeries. I know that you, of course, have a great working relationship with GRMC. One of the questions that has been posed to me is in communications with GRMC, are they currently conducting their operations as normal in terms of elective surgeries?
Senator, I apologize, but I don't have that information. And I know at one point they suspended also their elective surgeries, but I think they resumed some of it. But to what extent? And I don't have that information. I can certainly ask CEO Dr. Mike Cruz or the Director of Nursing Services, Ms. Jennifer Cruz, and we can get the accurate information. I don't want to assume anything, and I don't want to
Right.
with them. So I can follow it up with either Dr. Mike Cruz or Ms. Jennifer Cruz.
Can you, Lillian? Because some of the questions that I had that came into the office were, I mean, sometimes, and I know this is definitely from Dr. Uggan and you know the physician side. Some of these elective surgeries that some of these folks have called in on, they call them elective, but people feel that they're somewhat more urgent. And I'm sure you're sensitive to all that, but maybe some sort of public announcement on that in coordination, just so that our people know. Like I said, some of them feel as though their surgery, although elective, is quite urgent. So those were the questions that came to me. And so thank you for that and the follow-up. The final question, Lillian, have you incorporated working with Ancestral Lands Commission as the current preferred location continues to be Mingilao for the new hospital? Because also my office has received a number of calls from original landowners saying that they're concerned about the way the current situation in terms of return of lands is currently structured. Have you been in discussion with Ancestral Land so they can assist you with that process?
No, sir, I have not been at all involved in any communication with the I guess, commission. My understanding is that the land is still owned by the military and they're not returning it to the government of Guam. They're licensing, giving us the license or giving the government of Guam the license to lease it. And so it's not being returned to the government of Guam.
Okay, I'll work with the oversight chair because I think there might still be some concerns there. I just want to have you cognizant of it, and maybe put it on your radar to work with DLM and Ancestral Lands, because there are some interpretations from, albeit individual interpretations, that if there is a lease, who should be the beneficiary of that lease, given the fact that you're right, it's not returned, but it's utilized, right? So I just want to put it on your radar to avoid, any further delays. That if we're doing it on the front end, we may be able to head that off if it does become a problem. And maybe our chairperson, Madam Speaker, will speak to that in closing. But I just want to put that on your radar because it has been brought to my attention. Other than that, once again, thank you for all the hard work that you folks are doing over there. We really appreciate it. And once again, thank you for a very excellent presentation. Madam Speaker, that's all I have at this time. Jesus Masi.
Thank you.
Senator Duenas. Senator Frank Lacio recognized.
Thank you, Madam Speaker, and to Lillian and to the team at GMH. Thank you for what you do on a daily basis, and I can say this, that's that 24/7 operation, that an operation that we need to make sure that continues unfettered. A couple things. First off, there was a memo that was I guess released several weeks ago about some concern about with lack of medication, that was in the inventory of the hospital. Have we since resolved and made efforts to make sure that that kind of memo, is no longer necessary?
Thank you for bringing that to our attention, because it was brought to our attention also when it came out, and it's unfortunate that this internal communication is really for the purpose of informing, particularly the clinicians, to let them know that we are running low on medications, and it wasn't intended to be sent out to the community, but we do have leaks in the hospital, and so we have we address that issue in terms of medication being short, and we do keep track before it gets really low that there are orders submitted. And so sometimes it's the manufacturing company that is low on their supply and they're not able to send it to us. but very rarely that it is because of finance. And I know Yuka, she makes sure that these are priority. Pharmaceutical items are priority, and so she makes the payment to these companies. I'm looking at Belle Rada, who oversees pharmacy. I can let her also, provide additional information.
Thank you. So the shortage is actually, some of those are national shortage that we don't have any control. So, and then most of it, if we run short, we have substitutes. Like, let's say, for example, 500 milligrams is not available. We do inform our clinicians that there are substitutes to these medications, but we rarely run out of anything that we don't have any control of. We really try to find medications that we need, but it rarely happens. When we put out that memo, it's just to inform our clinicians that there are substitutes to the medications. And anything that is, if I may repeat, anything that is national shortage, we don't have any control to that.
And I appreciate that because, when that first came up, when that memo first came up, there are a couple of things came to mind with me is again, unfortunately, the uncontrollable, I guess the shipment of it, worldwide, not just in pharmaceuticals, but in many other industries and many other commodities, there continues to be a shortage, not so much because they stopped manufacturing, but it's hard to move. And so I was thinking on the lines of, again, it's a delay in shipping, but that said is I'm hoping that there are measures in place to be able to foresee that possibility and try to stock up as best that you can, so that you don't go through that again. I appreciate that. My second question is, and this goes to, sure.
Senator Frank Blas,
Sure.
I just want to add to Belle Rada's statement. This is Jolene again. So I do want to let you know that if the medications are a high demand for COVID patients, there is a national shortage, especially for critical care medications, such as medications that we use for sedation on intubated patients or pain. Okay,
Okay.
so I do want to put that out there. It is a national shortage. We have been notified, and we have been at the forefront trying to get some of this medication sooner rather than later. Unfortunately, we are competing with the world.
Yeah, I understand. And which is why again, the concerning thing was okay, where was it connected to? Was it basically a shortage because of the lack of the transportation? Was it a shortage because there was a shortage nationally that was beyond your control? Again, I appreciate that you're continuing to do all the efforts that you can to be able to ensure that your supply and your stock you're fully stocked. But then there's also the alternative medication
Right.
that can be utilized. I appreciate that. My second question is I guess, and this is directed to Mr. Kando. In the presentation, there was some mention with regard to FEMA and the utilization of FEMA funding to be able to make some of the capital improvements, the repairs and whatnot. Is there an open disaster?
I'm sorry, can you repeat that last?
You made some reference in the presentation to FEMA funding. Okay, whether it be for capital improvement, whether it be for acquisition, equipment acquisition, and the like. My question is there an open disaster with FEMA for Guam?
There is a public assistance grant that's ongoing, has been ongoing for COVID for quite some time now. And so as a part of for example, as a part of the SNF alternate care facility grant that Lillian was referring to earlier, that is a part of a FEMA public assistance grant that where GMH is a sub-grantee, and Guam through the Guam Homeland Security is the main grantee, and that we're working directly with FEMA to basically implement that public assistance grant program.
Okay, so this is so this is tied to a national emergency then?
It is a part of the president's disaster declaration. Yes.
Okay, do
Yes,
we
sir.
have any local open disasters that you're getting money from?
We've been closing out grants from previous typhoons. So anytime we have a local disaster that GMH can take be a benefactor of any kind of FEMA grant program, we're taking advantage of those, and we understand that there's an upcoming hazard mitigation grant program cycle coming up. We were informed by Homeland Security, and so we'll be looking at working with Homeland Security for taking advantage of some of those as well. So yes.
Okay, under the hazard mitigation, what was it specifically targeted for in the area of mitigation?
That one, I believe, is really more general, not specific. The new grant cycle for hazard mitigation grant is not specific to COVID. It's really more that's usually more connected to tropical cyclones. But if it's some other hazard, then we'll certainly be informed by Homeland Security.
Okay. Well, again, Lillian and to the team, thank you very much for all that you continue to do. We continue to pray for you. And as evidenced here, we'll try to do this best we can from our body to be able to continue to help you all. Thank you very much, Madam Speaker, for the opportunity.
Thank you very much, Senator Blas. I'd just like to ask two more questions, if I may, before closing, and that is, yeah, I'd just like to note, and we have some of the board members present here today, and thankfully, thank you, Linus, for sticking with us. But so I'd like to, yeah, just make a standing request, if it's not already noted, for CMS reports. In the recent news article, it was stated that perhaps the board's authority is necessary for the administrator to release those reports. And so I would ask that the board consider that. And I believe, I've seen these reports in the media sometimes, and but I would ask that the legislature be informed as early as possible regarding early findings and final reports as well. But I know that, the finals don't come out for a while, but I think that we should be informed as we go along regarding those CMS findings. The second one is, yeah, I just want to confirm. So we've increased the COVID capacity, and congratulations. I see that is very significant. We've increased the ICU capacity and the SNU capacity. But I want to know, so the 161 maximum beds are available. Is that a permanent increase in overall capacity, or is it the same as prior to COVID? Have we increased our overall capacity at GMH? Permanent.
That 161 is our permanent licensed acute care bed capacity, which is quite different from our staffed capacity. And then sometimes we're utilizing some of those 161 beds for other multi-purpose patient care services, and we're just flexing our capacity to meet whatever the COVID response and recovery demand dictates.
All right, but we've made permanent improvements to increase with these federal funds, for example, to increase overall capacity. Is that right?
The permanent improvement are the negative air pressure, the electrical sources for, critical care, intensive care patients who need to be on ventilator and hemodialysis, and COVID care unit 2. That's really a specialty clinic, but we restructured it and converted it, transformed it into an inpatient care unit for ICU level. So those are additional bed capacity that we completed last year. We've also used the rehab, the physical therapy. We've converted that for additional beds when we needed to, but right now we're keeping the rehab people in that area. We're not displacing them. But those are some of the areas that we expanded our bed capacity. in response to this COVID and also the non-COVID.
Including, of course, and then including also the Blue Med tent that also added bed capacity in support of the ER.
All right, thank you. And then just, the budget, we talked about, I know Lillian, you said you were disappointed that the budget was reduced by 10 million, but I know that at the GMH's budget hearing, we clarified repeatedly that, so the request from the governor was $18.292364 million. And that was, it's less than last year. And we made a big point about that, whether GMH was able to work with that, and the answer was yes, and that because you would be receiving ARP funds. And so I just want to clarify that we did give what the governor requested, not any less, and with the understanding, as you represented at the hearing, that there would be ARP funds coming to you. So we've heard today of the 7.27 million that's being sent over to GMH for funding for vendors, that you're going to take care of that. And if you could just keep us informed of any additional ARP funds that you are going to be receiving, that would be helpful.
Yes, ma'am.
Madam Speaker, this is Yuka. Can I also make just a point that we also didn't receive, well, actually DOC didn't receive the appropriation. We normally budget about 2.5 million for us to run the DOC clinic, and in the budget bill there were only 390,000, I believe. So we will still be providing the outpatient clinic at DOC, but we will more than likely not get reimbursed for it.
Well, please keep us informed of the status before it gets to become problematic, as it did before. If you are invoicing them and they are not paying, then please bring that to our attention right away. Okay. I know that's a matter of DOC's budget request, and so we will follow up, but please, if you could keep us informed as to the status of your invoices and their payments. I know it became a big problem because of the overdue, but let's get ahead of that if we can.
All right, thank you.
Thank you.
So again, I want to thank the board members for ensuring that this update happens, and that and ensuring the work of GMH in compliance with CMS standards, pursuing accreditation, and of course in our COVID response and our daily care of patients. Very much want to thank Administrator Posadas, Dr. Berdalio, Dr. Uggan, and your entire management team for all the work that you have done throughout this time and today in preparation of this, for giving us a very thorough update. I know some of us would love to talk about this forever, and there's so much to talk about, but you are very busy as well. So I recognize that, and I know your time is very valuable, and I very much appreciate the time that you have allowed for this update and for the public to know. I think it's very important that, GMH, that we continue to work together to instill confidence in the people of Guam and our public hospital, confidence in our plans moving forward, and confidence in our response to COVID, especially. And I think that these updates, they do that. The more we can give them information, it will also hopefully affect their behavior as well where necessary, and will affect all of our ability to work together to assist you in your mission and in your service. I am very happy that you have received 26.5 million in federal grants so far, and that you will be receiving more in ARP funding, that there is progress in the critical CIP projects that we have had oversight hearings in past terms over. And so it's great to see that these things continue to be, top priority for you as well, and that you are showing us the progress of these. For example, the electronic health records, it's important. I know it's been put on pause right now, but I'm hoping you get back to that right away. It's 72% complete so far. That you've got the A&E designs for the HVAC system upgrades, the hospital roof, and improvements have been made to the telemedicine program, and hopefully those will continue permanently. Thank you for all your efforts in those regards, and many, many more. And especially I want to thank all of you for your work on the front lines. Can't thank you enough for that. And Lillian, I really want to thank you for going on the radio and talking to the people of Guam directly. I think it's been very important throughout this time. Dr. Uggan as well, Dr. Berdalio, all of you. And the more you can do that, please continue to do that. And so again, Thank you to the board. Thank you to all of your staff. And please extend our thanks to all of your employees at the Guam Memorial Hospital, from all of us here at the Guam Legislature. We are very grateful. And with that, we are going to conclude this hearing. We will provide a transcript to the public. We'll put that on the legislature's website. And again, Sidus Ma'asi.
Sidus Ma'asi.
Thank you.
Thank you.
Have a great day.
Have a great day. Bye-bye.
Thank you, senators.
Don't forget the